All right. So, as a part of introduction, we're asking folks to introduce themselves on chat, say where you're writing in from or calling in from, and also a little bit about your hiking experience. Excellent, excellent. All right. The deer face attached to Mercurio's iPhone. Can you tell me your name so I can mark that you were here? Maybe that'll come up in the chat. Welcome, Audrey. Glad you're here. Welcome, Meg. Thanks for being here.
Okay.
There's Marianne. Welcome. Glad you're here. For folks who are just joining, we're just putting in the chat the city that we're calling in from tonight, as well as waving at our neighbors, as well as our experience with hiking. All right, Griselda, welcome. I'm glad you're here. How lovely to have you with us tonight. We have a good showing of staff from Santa Rosa Community Health. That's lovely. Quite lovely. All right, we'll have more folks who are filtering in as we go, I'm guessing. So let's go see who's here. What's going on with our people? Let's see. So we've got Michelle here from Santa Rosa. We've got Tara from Healdsburg. She works at Santa Rosa Community Health and has been a couch potato for the past couple of years and wants to get back outdoors. You are our target market, my dear. And also you're a lovely human being, so that helps. Emily Webster's writing in from Sebastopol, hikes occasionally but walks a lot, and hardly uses her car. This started with a broken arm and not being able to drive. Wow. That's wonderful. I'm not glad that you broke your arm, but I am glad that it inspired something good. All right, and we've got Audrey and Diego Mosquera from Santa Rosa, our beginner social hikers. Excellent. Welcome. You are also our target market. Melissa from Katati, originally from Ohio. Wow. Some hiking experience, most difficult would be at Red River Gorge in Kentucky. My goodness. If you're just now joining us, we're just putting a little note in the chat that says where we're calling in from and a little bit about our hiking experience. Let's see, back to Michelle from Santa Rosa. She climbed Mount Whitney 30 years ago. Wow. But just here and there locally for the last several years. That's wonderful. You're also our target market. I don't know if you've noticed, but everybody's our target market. It's turning out. Lorelei is from Santa Rosa, a light hiker and walker, I happen to know. Santa Rosa, Lila from Santa Rosa has done lots of Sonoma County hikes, not more than 6 miles. That's awesome. Marianne from Santa Rosa has done lots of hiking and backpacking. I did not know this. That's exciting, the backpacking part. Meg from Santa Rosa does regular, easy to moderate short day hikes. That's great. Lori's calling in from Santa Rosa. She's an experienced hiker and participant in last year's challenge, wanting to up my game. Oh, and do the 20-mile challenge this year. Yay! That's very exciting. Lori also is the recipient of one of our epic trophies from last year, which is kind of awesome. We're among greatness. Oh, and I think we're going to get to see it. While we're waiting, we've got Griselda, who's coming from Petaluma. She did the Epic Trail Challenge in 2020. And there's Lori's Epic, what's that called? Trophy, yes. And the words on it are most funds raised, right? Something like that. Top fundraiser, there we go. Top fundraiser. Griselda says she continues to hike occasionally with family and friends. Well, wow, what a great crew of folks we've got here. I'm super impressed and really excited to have you all here with us. Let's see here. I'm going to mute a couple of folks just because it's the right thing to do. and it makes my recording nicer. All right, so let's go ahead and get started with some things. You're welcome to ask questions anytime you'd like. You're welcome to, you just need to unmute yourself. I won't be able to see the chat while I'm doing the presentation because of the weird screen sharing adventure, so you'll have to holler or wait until the end. And so let me get that pulled up here and get us all started. I'm really glad you're all here. Thank you for taking time at the end of a holiday for some to be here and with us. It's very cool to have you here to talk about the Epic Trail Challenge. So in addition to being the lady who's talking throughout all of this fun part, I am also the challenger in charge. My name is Laurie Lynn Hogan, and I'm a former employee of Santa Rosa Community Health. I was the fundraising and communications director for 8 years and went off to try my hand at some other things, and ultimately in May of last year realized that I wanted to bring this Epic Trail Challenge idea to Sonoma County, and I wanted to do it with Santa Rosa Community Health. And we both found that it was a really great fit. So I feel grateful to be in the process of developing our third annual event. This will be the third time that we've done it. As we go through all of this, the first part of this is that I'll share some information about Santa Rosa Community Health, and then we'll talk all about the Epic Trail Challenge, all the details of the challenge, both the hike part and the fundraising part. In the meantime, there's a bunch of pictures in here, including pictures of people who were on this call. Wow! So I'll try to tell you where all these pictures were taken because they were taken during Epic Trail Challenge events. So this is at one of our practice hikes that we did at Jenner Headlands. And the person in this picture is Barbara Thorson. She's one of our Epic volunteers. So let's start with Meeting Santa Rosa Community Health. This is the organization that the Epic Trail Challenge supports. And here you can see the vision for the organization, which is envisioning a just and healthy community where all people can achieve their full potential for health and well-being. The health center supports over 40,000 patients. That's 25% of the Santa Rosa population. And they do this by providing medical, dental, and mental health services at 8 distinct campuses, soon to be 9. We'll talk about that in a little bit. And there's nearly 500 employees like the ones that you see here in this photo. The patients at Santa Rosa Community Health are a really specific group of folks. About 80% of the patients live at or below the federal poverty level. And about 75% to 3/4 of our patients identify as Black or Indigenous or people of color. 33% of our patients are youth under the age of 18. And nearly all of our patients experience health disparities, meaning they have a shorter life expectancy and higher rates of chronic disease, as well as higher rates of mental health and substance abuse use disorders when compared to the population of Sonoma County overall. So this is why the health center's mission and values all include the concept of health justice. We truly believe that everyone deserves the right to a full and healthy life, regardless of our race, our income, our primary language, immigration status, education level, or any other traits you can think of. Everyone should truly believe or should receive the highest quality care that honors them and meets their unique needs. That's why our tagline for the Epic Trail Challenge is Hike for Health and Justice. It's baked into the work that's done at the health center, and it's a big part of the work that we're doing. So let's talk a little bit about what the heck is an Epic Trail Challenge. And there's 2 challenging parts of this third annual Epic Trail Challenge. The first is a hike. It's either an 11 or 20-mile hike that takes place on May 21st of this year. That's a Saturday. And it's also a fundraising event. We'll talk more about the fundraising event later. We're going to focus first on the hike, but then even before that, we're going to talk about a little public service announcement. But before we go from here, this photo was taken at Annadel State Park, one of the places that we try to do our at least one of our practice hikes. So, okay, a public health announcement about being epic during COVID and tsunamis and possibly fires and maybe floods and or vampires, volcanoes, and locusts. When we first started the Epic Trail Challenge, it was during 2020. The pandemic had just started. And we, at that time, made this commitment that we would do as much as we can for as long as we can and go as far as we can with the health and safety of our participants as our top priorities. And this has just become our motto today. It's really how we're operating, particularly at a time where Omicron has put a little bit of a hitch in everyone's giddy up. So we know that we can't eliminate all the risk, but we can work together to mitigate it. We know that Omicron is spreading rapidly, and we're monitoring conditions very closely, including our most recent health order by Dr. Mays. So as a health center, we're committed to following CDC and county health guidance around gatherings. And because things are so fluid right now, we're still finalizing our COVID policies for practice hikes and challenge day. They're probably going to include some or all of the following: negative test results for participants in in-person gatherings, maintaining physical distance from people who are outside our household or team or pod, masking, and submitting vaccination status. As a health center, we strongly encourage people to get vaccinated and boosted. And as an organization that acknowledges and respects diversity and choice, we are not requiring vaccinations for participation in the Epic Trail Challenge. However, people who are unvaccinated will likely have additional or more stringent requirements for participation to keep everyone safe, excuse me. So I'll pause here and ask if anyone has any questions about trying to run an Epic Trail Challenge during a pandemic or endemic. Again, you'll have to unmute yourself so that we can hear you. All right.
So,
go ahead.
Laurie Lynn, did you say that everybody would have to get a negative testing, whether they're vaccinated or not?
That's the direction that things are leaning at the moment.
Okay.
That we would be looking for folks to show up with a negative test. Not totally finalized. We've got sort of another month of learning from what's happening in the world to really give us an answer on that.
Would that be on every single hike or every week, or you don't know how often?
Well, so it would be for in-person gatherings. So the primary in-person gatherings that we have are on Saturdays during our practice hikes. So it would be once a week. And the conversation that we're having now is that rapid tests would be sufficient. It wouldn't need to be a PCR test necessarily. So again, waiting for more information, gulping up as much information as possible to try to make an educated decision about how to proceed. Yeah. Okay. Thank you for that question, Emily. Other questions? Hearing none, we shall go forth back into the land of PowerPoint, where life is happy all the time, except for when the bar for Zoom covers the bar for the PowerPoint. All right, so this concludes our public service announcement. And now let's talk about our epic training hikes. That was a perfect segue question. Emily, thank you very much. This picture was taken at Bodega Head last year during one of our training hikes, at the beginning of one of our training hikes. So our training hikes are really designed to prepare us for challenge day and to help us build confidence so that when we get to challenge day, we're in our bodies and strongly walking through it. They take place every Saturday beginning February 12th. for 14 weeks leading up to Challenge Day. There may be some play here depending on what happens with Dr. Mays's request for not gathering. So there may be either a delay in start, or we may suggest that folks do some of the practice hikes in the beginning on their own. We'll figure it out. I trust us to figure it out. So there are two different hikes, as I mentioned. There's an 11-mile hike that we call the 11T group, and there's a 20-mile hike that we call the 20 group. See how those are related? Each of those hikes have the people who are training for each of those hikes have different mileages that they train for at our training hikes. So on the 12th of February, the 11T group has a hike that is, I think, 1.13 miles long, and the 20 group has a hike that's 1.8 something miles long with very minimal elevation. So it's a really gentle step in. If you've been couch potatoing like Tara and me, or you've been out walking every day like Emily, you can step into this with ease and grace and not feel like you are going to die on Sunday the 13th and not be able to move for Valentine's Day. Like it's a really gentle start. So the training hikes then each week increase in mileage and they increase in elevation. So over the 14 weeks prior to the 21st, we're building up your stamina and your momentum and your ability to climb hills especially. So the training hikes are recommended. They're not at all required. We want you to train with us in this way, but you don't have to at all participate in them. And you can do them on Saturday mornings with us, or you can do them on your own time. So I'll talk a little bit more about that in a minute. So we have a training program on top of the training hikes. This picture was taken at Lake Sonoma, and the training program really comes from being developed by our training partners. We've got a partner at Baseline Training and one at Heart and Soul Sports. So our training partners have come together and built out this epic training program for us that includes a bunch of different things, including these training hikes. One of them is suggested mileage to walk or hike during the week. It starts at half a mile or 1 mile on a Tuesday night and a Thursday night, so twice a week, and over the course of 14 weeks increases to 3 miles for the 11T group and 6 miles for the 20 group, 3 times a week, carrying weight. So there's a nice flux over time that takes place. There's also suggested rest days. I like to point those out because those are my favorites. We also have cross-training exercises that you can do at home with no equipment. I think one of them requires a couch. Hopefully that's not a problem. And these exercises strengthen the exact muscles that you need to be able to do an 11 or 20 mile hike in one day. You can either follow our schedule or you can do other things you love for cross training. You can ride your bike, you can do yoga, you can swim. The idea is during the week, we're giving you tools and inspiration, hopefully, to do more than maybe you are now, or maybe it's the exact same amount as what you're doing now, to supplement where you are now. We also have training clinics. So we bring in local experts who have important stuff to say about things we need to know, like how to get started, how to avoid injury, gear and equipment that is useful to you out on the trail when it's 90 degrees outside or when it's 30 degrees outside, how to prevent blisters or how to keep them from wrecking your hike, what to eat, what to drink, and lots of time for questions and answers so that we can get your specific needs addressed. Our training clinics are not a time to be shy. They're a great time to say, here's my problem, this is what I need. We record all those training clinics so that other people can learn from the questions of the folks who are there, and so that people who weren't there can get the information that is shared. So that's the program consists of those elements along with our training hikes. And we know that life is full, right? That you can't always find the trail. You can't always get in your, 20 lunges that our training program is suggesting that you do that day, or that you can't go find another trail that week. And that's okay. The idea of the training program is to provide a structure in which you do as much as you can so that you have fun on challenge day. Because you could maybe go hike 11 or 20 miles today, maybe, but it would probably hurt pretty bad and you wouldn't feel very good the next day or the next week, probably. So the idea is we want to give you as many tools as possible to feel as great as possible to do this epic thing that is hopefully going to make a big change in your life. We also want you to feel safe and we want you to feel confident every time you are participating in one of our epic adventures. So let's talk about safety a little bit. This picture, it was taken on the top of Mount St. Helena, overlooking the Sonoma side of things. So in terms of safety, we've, since the onset of the Epic Trail Challenge, have had a check-in time rather than a show up at 8 a.m. and we all go. We do this window that's usually between 7:30 and 8 o'clock in the morning, and at the trailhead. And during that time, you would check in with me or Barbara, who's in this photo, or other volunteers who are there. We talk to you about the route, make sure you have your GPS all set up, or if you don't, we make sure you're with somebody who does. We make sure you've got the water that you need, you don't have any questions, and we'll send you on your way if you're ready to go. If you're looking for somebody to hike, a lot of folks are, and there's always somebody to hike with. Somebody else always wants to hike with you. So there's no worries about that. At the very least, at the very end of things, even if there isn't anybody, our volunteers and I always hike at the end. So it's us. It's us if nobody else is available. So if you want to go solo, you can. If you don't want to, you don't have to. And then in terms of those Saturday morning check-ins, I also ask folks to text me when they're done. So once you've told me you're there, I track you. And I pay attention to who checks it out and who tells me they're done. And if you don't text me, then I text you and go, hey, did you forget to text me? And most people go, yes. In fact, that's always been the case so far. But if somebody didn't respond to me, then I would reach out to their emergency contact and say, hi, your person is missing. Let's figure out what to do here. So that's part of our safety plan. We also have these flags that you could see. Kathy here is wearing it says Epic Trail Challenge on it. Barbara has one too. We give these flags out to all of our challengers. We ask them to wear it on the trail. It's especially during this time when we kind of all look like we're running from the law because we have on a mask and sunglasses and hats as we're getting ready to go on our hike. It's hard to recognize people or, see them, but you can see this flag that they're wearing on them. And if you need help, if you're uncertain about something or you wished you had a Band-Aid, but you don't, something like that, there's other folks on the trail who are probably going to be nice and help you because there are people. And our Epic Trail Challengers are really good people. So our flags are part of our safety program as well. This year, we're using a new GPS navigation system. It's called Strava. And one of the functions of Strava is that it has a beacon option. This is a way that you can text your location to up to 3 people of your choosing, and they can track where you are. So we'd like you to set up your beacon so that one of those folks is your emergency contact, so that if I call and go, hey, that person's missing, they can go, oh, they're right here. So that's another safety feature that I'm excited to include this year. As I mentioned before, in terms of if you're concerned about group gatherings or being too close with folks or being there on a Saturday when there's a lot of people on the trail, you can practice hike anytime. You can choose another time. There are many times during the week when there aren't a ton of folks on the trail. And that early morning start also, that between 7:30 and 8, lots of folks are very angry with me because I suggest that we do that, but that's partly because it's not as crowded, and it's also partly because as our hikes get longer, we finish them before it's too hot outside. And then last year, and the year before, actually, we requested and enforced the idea that we maintain physical distance from other folks who are not part of our household. And if we're passing folks on the trail and can't keep that 6 foot distance, then we ask people to wear masks. We'll firm up what that request is for folks this year and make sure that it's clear to everybody. But that's another part of how we've tried to keep people safe, minimize risk when we're outside hiking. All right. So that's all of our training hike safety. We also have a couple other resources that are available to support both our training and our fundraising in the realm. First is our Epic Scoop. That's an email newsletter that comes out once a week on Tuesday afternoons at 4 o'clock, as a matter of fact. Those newsletters have, first of all, our route for the week, our practice hike for the week, both for the 11T group and the 20 group. Sometimes I even remember to link them to the right place. There's also updates or changes during challenging times. We have to be a little nimble. So that's where we primarily announce any changes that we need to make around protocols or locations. That was particularly important in 2020 when there were a lot of fires and smoke. We also answer questions. So a lot of times folks will ask questions on the trail and I'll answer them on the trail, but they're good questions. So then you see them that week in the Epic Scoop with answers and pictures. We also have tips from local experts, past challengers. There's just lots of good, juicy information in that Epic Scoop, lots of pictures too. We also have a private Strava group. So this group is similar to a Facebook group, which is how we've maintained some kind of community during COVID when getting together is a little challenging. This year, we're going to do it on Strava. And the reason we're going to do it on Strava is because once you're a part of this group, when you record your hikes or your walks during the week, they instantly automatically go into our group. So we can see what people are doing. You can share your pictures in that way. And you can ask questions, post ideas and suggestions. All of that good stuff it's lovely. So we also will be using that Strava group once again this year for the folks who were participants last year. We'll be doing another drawing for $100 donation to your fundraising total each week. So folks who record their hikes in the Strava group will be entered to win this $100 donation that's randomly selected among our participants, and it's kind of cool. So we've got a really cool donor who helps us do that every year so far. This photo is on the opposite side of Jenner Headlands as the original photo that we were looking at. So let's talk a little bit about what happens on Challenge Day. That's May 21st. That's the day we hike either the 20 or 11 miles. So everybody, including me, wants to know where Challenge Day is going to take place. Unfortunately, I don't yet. What I can tell you is that in the past, in 2020, our Challenge Day, our hikes started at Jack London State Park and went into the Sonoma Developmental Center and through Sonoma Valley Regional Park and made a big loop for the 20 group. The 11T group got to see a whole bunch of Jack London State Park and some back trails that are really stunning. Last year, we started both of our hikes at Shell Beach out on the coast at Sonoma Coast State Park, and we all hiked into Pomo Canyon. The 11T group turned around and went back to Shell Beach and then got to hike along the Cordum Trail for the last part of their 11-mile route. The 20 group continued on up Willow Creek Road into Willow Creek State Park and did a loop in there and then came back to Shell Beach at the end. So wherever we're going to have our epic challenge this year, it's going to be something pretty stunning like that, where you get to see a whole lot of Sonoma County and a whole lot of amazing trails. So stay tuned on that front. We'll reveal that information when we have it. So after we've trained together for our 14 weeks, we're going to have our challenge day, and here's what that day has in store for us. the great thing about Challenge Day is that we don't just spit you out on the trail and say, okay, good luck, we hope you make it. We actually have aid stations that we staff throughout the route. So there will be 2 to 3 aid stations where challengers can stop and get water, do some first aid, get food, work with medical staff if need be, essentially get their needs met. Oh, there's chairs too. That's a really good part of the, the aid stations I found. We also offer the option for each challenger to prepare and bring a comfort bag. This is a bag of any kind. I used to say trash bags until I realized nobody listened to me, and there were some very exciting and interesting kinds of bags that people brought. So bag of your choice, filled with whatever it is you would like us to hand back to you at the halfway point of your hike or near the halfway point of your hike. This could be dry socks. It could be chocolate. It could be specific electrolytes that you don't want to carry. It could be food that's in heavy jars. It can be pretty much anything you want. It's also a good place to drop off stuff that you're not going to use anymore because it's presumably going to get warmer throughout the day. So that's a service that we like to offer. It's all stuff you could carry, but you don't have to because we'll just drive it there. There's a warning that we are probably going to have a pretty early start time. Last year, our first challengers got on the trail for the 20 group at 6:30 in the morning. This is because we like to have everybody home before it gets dark. It's also, again, because it helps with parking and helps with keeping the crowds off the trails at popular times. We stagger our start times. This is part of how we try to ensure that we don't have large groups of people gathering. That's part of our commitment to keeping folks as safe as possible, reducing risk during COVID. And then, gosh darn it, I think Omicron gets to determine what we do at the end. If it's up to me, we're going to have a keg of beer and a couple bottles of wine and some delicious food, like a taco bar maybe. And we're going to sit around and eat and drink and tell stories and enjoy each other's company. I've wanted this every year since we started, and this may be the 3rd time I don't get it. I don't know. But that's what we're shooting for. Also shooting for the possibility of maybe there being camping so that you can camp the night before and or after and just be home when you're done. So those are potential options. Let's see, what else? This photo is from Jack London State Park. This person is on our call right now. Let's see. Oh, this brings us to the fundraising part. So right. So fundraising is a second part of the challenge, and it's really how we get to give back in exchange for all the stuff we're getting through the training, the benefits that we're receiving as challengers. And most folks want to know just right after, how much do I need to raise? They want to know, what the heck am I raising funds for? So we're going to do that in reverse order. We're going to start with the most basic question, which is, why are we fundraising? So I have a quick video for us to watch. It's about 5 minutes long, and it features Naomi Fuchs, the CEO of Santa Rosa Community Health, talking about how the Epic Trail Challenge is going to help fund the health center's 9th campus at Caritas Village. So here is our sweet little video.
Can you imagine going from place to place to place and having to retell your story, show all your whatever documents you might need to show or try to find, when you have no place to live, no place to store things, difficulty with transportation? It really is an incredible relief for people to be able to just go tell one person their story, not be re-traumatized over and over again, and know that we're here for them, that we're going to meet their needs no matter what. My name's Naomi Fuchs. I'm the Chief Executive Officer for Santa Rosa Community Health. I'm excited to talk to you about the Caritas campus, which will be our health clinic embedded in Caritas Village, a comprehensive program caring for people experiencing homelessness. We love collaborating with Catholic Charities on this project. Being able to bring medical services into an environment where people can access a whole breadth of support services that they need, including social work and case management, is really the ideal way to deliver care. We think that we'll be caring for about 3,500 people a year. It's a small clinic relative to some of our other campuses, but it's very specialized with wraparound support services, social work, psychiatry, psychology, as well as medical services that can address the complex needs of people who are without shelter. We've had a clinic for people experiencing homelessness on the corner of Brookwood and Sonoma Avenue called our Brookwood campus. It is really small, quite run down, not adequate bathrooms or services, and it's separate from where everyone goes for their other care and other services. So we are going to be moving the staff and providers from the Brookwood campus to the new Caritas campus to provide a much more welcoming as well as integrated approach to services. So being able to say, come to this one location where you can have all of your needs met in one place, including short-term housing, is both innovative for Sonoma County, but really well known to be the best way to address people's needs for long-term success. The exciting part about this project is that we're also able to provide permanent supportive housing in a collaboration with Burbank Housing, who's building a complex of units for people to live in. So you've got housing, you've got support services, you have medical and mental health and dental care all in one place where people can come and have a coordinated approach to caring for their needs. Everyone deserves to have a warm, welcoming, up-to-date, respectful environment to get their medical care, regardless of where you live, your education, your ethnicity, your identity. Everyone deserves the best possible care. Homelessness is a really complex issue. It's not easy to solve, we all know that. But we need to start by giving people the resources they need, the health care they need, and the dignity they deserve. This is essential to health justice, to health equity, and making Sonoma County a just and healthy place for everyone. In order to create this vision, to make this vision a reality, we need your help. We need the whole community to get behind making life better, improving the opportunities for people experiencing homelessness. We need your help to buy exam tables and equipment and furniture and electronic health records and all the things that go in to making a high-quality healthcare system for all. It really does take a village to improve our world and make it a better place, a more just place, a more equitable place for everyone. Your participation in the Epic Trail Challenge will go a long way to fulfilling our vision at Caritas Village to create a coordinated system of care that reduces barriers, creates coordination of services, and brings health justice to people who need it most. Join us in the Epic Trail Challenge. Push your limits, challenge yourself, and make a lasting difference in the lives of 3,500 people who will get services at our Caritas campus.
So I know that for some folks, the idea of trying to do fundraising is an even greater challenge than the idea of hiking 11 or 20 miles. And what I hope is that seeing and hearing about what it is that we're supporting makes it just a little bit easier, a little less scary, because it's just such an amazing gift that we're helping to create for our community. If you've just joined the call or you joined since we started out by putting into chat the city that we're calling in from and a little bit about our hiking experience. So if you haven't had a chance to do that and you'd like to do it now, I invite you to make that happen. In the meantime, I want to tell you that we have for our challengers some minimum fundraising goals. So this is the top question we get asked: how much money do I have to raise in order to participate in the fundraising challenge? And one of the things that I love about how we do things is we keep learning about how what works best. So the first year we told everyone you have to participate as an individual, and that didn't work so well for a bunch of people. So now we have teams, and if you're wanting to participate as an individual, that's okay. The individual fundraising minimum to participate in the Epic Trail Challenge is $2,500. We recognize that folks who live in the same household, it's challenging for them to each raise $2,500 because oftentimes they have the same contact list. So we've developed a household team that has a minimum fundraising goal of $3,500. So this is for up to 2 adults and as many kids ages 12 to 18 who are a part of that household. We also have nonprofit teams. These are for folks who work at or are affiliated with a nonprofit organization. Affiliated with means you are married to someone who works there, or you are a friend of someone who works there. Is a real loose definition. So that minimum fundraising goal is $5,000. We also have workplace teams. These are for-profit organizations, businesses, again, up to 5 adults who are affiliated with a particular workplace can come together with as many fundraisers as desired, but up to 5 folks can participate in the training and do the actual challenge day. Folks who work for Santa Rosa Community Health, we're going to continue to honor your amazing work in the world and all the ways that you have gone above and beyond in making healthcare accessible and meaningful and culturally relevant in our community by once again encouraging you to set your own personally meaningful fundraising goal. This is one of the perks that we offer to the folks who work for the organization that's putting this on. These might feel, maybe they don't, I hope they don't, but for some folks these feel like big scary numbers that may feel a little insurmountable, and I'm here to tell you that lots of people have done this. Folks exactly like you have thought there's no way I can do this. We've had 90 challengers so far go through the Epic Trail Challenge, and they've helped to raise $250,000 through the Epic Trail Challenge for the health center. 80, let's say, of those participants were super worried about the fundraising. And only one person in the history of the Epic Trail Challenge has not reached their fundraising goal. And that was the first year, and we learned a lesson from that, and that will never happen again. So the reality is, if they can do it, you can do it too. There's nothing standing in your way of being able to do this, and there's a whole bunch of support that's lined up to help you make it happen. So here are some tools that come in the realm of fundraising support. Oh, and this, by the way, is Chris Stewart. He's one of the practitioners at the Brookwood campus who will be providing medical care at the Caritas campus. And he's at Jack London State Park at our very first Epic Trail Challenge. So he was one of our participants that first year. So you might be wondering how other folks did this. Here's some of the tools that we've offered to folks in order for them to be successful fundraisers. The first is we give you your own fundraising website. It's for both individuals and teams. Once you build it out and put in your personal reasons for participating and your awesome photos of yourself out on the trail, and promote it through social media, through email, through text messages, you'll be amazed by how many people unexpectedly donate. The reality is that participating in this event is something truly epic, and your people want to see you succeed. So that website is a big part of how you do that. We also have fundraising clinics, just like the training clinics. We gather together and talk about common fundraising issues. We answer questions. We give individual support. And sometimes doing the fundraising is just about carving time to actually do it. So there have been folks in the past who come to the clinics and just sit there while we're there together with sort of the team support model and send out their emails or post on Facebook or draft things and then get feedback around it. So those fundraising clinics are a good part of the support that we offer for fundraising. We also have a fundraising toolkit. It has templates for all the things you could possibly imagine: emails, social media sample posts, video ideas, photo ideas. There's also the language about Caritas Village, because you probably didn't just memorize that. I could be wrong. You might be cooler than I am, but I don't have it memorized, but I have it written down, and that's part of our fundraising toolkit. We also have lots of fun and creative ideas in that toolkit for ways that you can raise funds, from pancake breakfasts if the darn COVID thing ever goes away, to raffles. The first year we had someone who painted a rock for everyone who made a donation to her above a certain amount. There's lots of really fun and creative ways to raise money, but honestly, our most successful fundraisers have simply and regularly shared their personal reasons for becoming involved with their family and their friends and their coworkers, and then have updated them on their progress when things were easy and when things were hard. And they've been dazzled by the results of simply sharing of themselves. They often posted photos and videos, which brought people along for the journey. And, folks got to see parts of our county that lots of people don't get to see because they're far, far away from the car. There's also options that we discussed in that fundraising toolkit for employer sponsorship and matching gifts. So if you work for a company that might want to have their logo on our t-shirt and be part of our website and all that stuff, I can talk to you about how your employer can provide a sponsorship and you can get credit for the money that they give. So those are all the really powerful ways that we come together to help support with fundraising. And it's possible that even with all the help that we're offering for both the hiking and the fundraising, you might still be feeling worried about whether it's something you can do. And one of the things that I love about this program is that if you're interested in trying, we want you to try. And we have a really low risk way that you can try. Here's how. So to get started, all we ask is that you give a $100 registration donation, which applies towards your fundraising goal. Then you can give the challenge a try for the next 7 weeks. That's nearly 2 months of access to all the resources, the emails, the training hikes, the clinics, all the support. Then on April 1st, 7 weeks in and 7 weeks from challenge day, we have what we call recommitment day. That's the time at which you or your team make the final decision about whether you want to go with us all the way to 11 or 20 miles and to your fundraising goal. If you work for the health center, that's the day that you finalize your fundraising and goal and say, this is how much money I'm going to bring you. So if between the time you register and April 1st, you decide to leave the challenge, it's not working for you for whatever reason, we will bless you and release you. No questions asked. We'll be grateful to have had you along for part of the journey. The funds that you've already raised will remain donated to the health center. Your folks who have given any money to you will still have that tax deductible benefit of having given to the health center. If you do decide to recommit, then you and your team are saying, okay, we're committed to attempting to hike 11 or 20 miles on May 21st, and we're ready to raise our minimum fundraising amount. Then you'll have until May 13th. That's 1 week before challenge day. That's the Friday before challenge day. That's the Friday 1 week before challenge day, to reach your fundraising goal. And with all this support, all the ways that we can help you out. Last year there were challengers who had reached their fundraising goals who just donated to each other. To folks who hadn't quite made it yet, and channeled some of their donors to other folks so that they could reach their goals. Like, I'm telling you, challengers are really good people. So if there's some reason you haven't met your fundraising goal on May 13th, then you'll have the option to make up the difference yourself if you'd like. For everyone who meets or exceeds their fundraising goals by May 13th, we book you for a slot for the Epic Trail Challenge on May 21st. So I want to say This is so cool. 100% of our fundraisers last year dramatically exceeded their fundraising goals. There was nobody who just squeaked by. It was really amazing. Oh, and this photo, by the way, is from Sugarloaf Ridge State Park when we did our practice hike there. So if you're ready to get started, there's a few steps that you need to get started. This picture was taken at Lake Sonoma. Normally I say today I'll send you an email, but it probably is going to be tomorrow. Let's just be real. I'm going to send you an email tomorrow that has information with our registration paperwork. So you're going to need to decide what kind of registration you're going to do, if you're going to be an individual fundraiser, a team fundraiser, or an SRCH team fundraiser. And then from there, you'll figure out which paperwork to fill out. You'll need to download it, fill it out electronically, and then send it back via email. If you have trouble with any of that, don't worry, I can help. So you'll do all the registration stuff, and then we'll give you information on how to set up your fundraising website. That is through an online platform called Classy. So you'll create your website following the instructions there. And then once you're done with setting up your website, you'll make that $100 registration donation to yourself via your website. Once those steps are complete, you have full access to our resources. You get our full training calendar with all the training information and all the cross-training stuff that I mentioned before, when the rest days are, when you need to get extra mileage in. You get the fundraising toolkit, you get all the training and fundraising clinics that we have in store for you. You get access to our private Strava online group, and you have our Epic Scoop newsletter delivered to you. And your Epic journey has begun, so you get to start training as soon as all those steps are taken. So just to recap, here are some important days for you. This is a photo that was taken at Annandale State Park. Our training hikes began on February 12th. Health orders willing. Our recommitment date is 7 weeks later on April 1st. Our fundraising completion deadline is May 13th, and challenge day is May 21st. Hopefully this will be you on May 21st. This photo was taken at our finish line at Shell Beach last year. So with that, I'm going to stop the share here. I'm going to come over here to chat and see who we missed. Let's see. So Matt is here, and he's hiked many miles of the AT. That's the Appalachian Trail, I think. Correct me if I'm wrong. We've also got Diane here from Petaluma, who's just getting into weekend hiking. Wonderful. That's excellent. Patty, one of our former challengers from 2020, is here from Petaluma. Happy that you're here, Patty. She, as I just said, hiked in the first challenge, but had to miss last year and need to get back into hiking condition. We know how to make that happen. All right, I'm going to change my view here so that I can see all your faces, and I'm going to invite questions. Questions. Regale me with your questions. I think Lila has one, but you'll need to unmute. While we're waiting for Lila to unmute, if you are a former challenger who wants to offer any feedback about, oh, never mind, here's Lila. We got you, you've got sound.
Okay. Well, that's a great presentation, I have to say. Really, you've got it down. It's a little overwhelming to hear all of this all at once, I have to say. So I guess what I want to know, maybe just right off the bat, let's say I don't know tomorrow what I'm doing. When do you have to, I mean, how many more of these sessions are you doing? I might have some friends who I can now convince to do it with me. Mm-hmm. So I want to know the timeline of you're going to send this registration. If I don't send it back tomorrow or in a week,
Forget it.
it just feels it's a little, I mean, I'm just personally, it's very exciting, but it sounds like a lot. So that's my thought.
Yeah, heard, and you're not alone. In this moment, after I stop my screen share, see lots of faces that are like, "Whoa!" So that's a pretty common response. The timeline is actually pretty open. So because we're working with this crazy, pandemic stuff, there's not a lot of hard and fast. We like people, the marketing people don't like it when I say this, but we like folks to sign up by the end of February. After that, it gets harder. That's a month and a half away. It gets harder to join after then. Like unless you've already been hiking, it gets harder after that to join without having some of the practice hikes under your belt. So there's plenty of time to talk with folks about it, get folks on board, sit and think, negotiate with yourself, call and ask me questions. I've talked to several people who are on this call today already and expect to talk to them again after this. So feel free to really negotiate and figure out for yourself what you need and call with questions. And we're pretty darn flexible and pretty darn accommodating to the degree possible. So there was one other thing that you said in there. What didn't I answer?
You're asking me what I said 5 minutes ago. Forget it.
All right. Well, if you think of something that you need to know that I missed, then please remind me or ask me again. Emily, I see your hand is raised. While you're, oh, go ahead.
Yes.
And Audrey, I see your question. I'll answer it in a second.
I forgot as well. Is there a form letter for the fundraising to send out that you have?
I do. I mean, I have a letter that I'm going to strongly encourage you to personalize that talks about here's what the Epic Trail Challenge is, here's what we're raising funds for. The more you make it personal to you, the more your friends are like, oh, I need to do this because it's important to Emily. So that I'll encourage, and I can help you with the personalization. We can have a little phone interview, and I can talk about like why does this matter to you, and how does this get to you. Does that answer your question?
Yes, perfectly.
Great.
Thank you.
Yes, you're most welcome.
And then I just want one little quick one. The beacon, what is it? This
Strava.
Strava beacon.
Mhm.
Is that something that is that an app? I'm not, okay.
Yes,
So
it's a
we can-
free app. It can be a free app. They want you to buy it. You don't have to buy it in order to do what we're going to do with the challenge. I was just working on writing up the instructions to join today. So those are nearly complete and
Good.
updated. And I think I'll probably do an instructional video that shows step by step in addition to the written instructions. So that folks who need some extra support around it can have it, because the technology, it has been a stretch for some people in the past, but it's so worth it when you get it. Having the GPS guidance on the trail makes a world of difference, particularly for folks like me who get a little turned around on the trail. So that's got it. Michelle, I see your note, and yes, I'm on it. I will take care of your request. All right. Audrey, and I see another hand raised. If my husband and I register as a household team, is the registration 100 or 200 for both of us? It's 100. Yeah. Team, we ask, any team that comes, it's just 100 for the whole team. We're trying to get a little skin in the game. Little skin in the game. All right. So I see your hand raised, Mercurio's iPhone. You put your name in the chat, but I don't remember it. I'm so sorry. Will you tell us your question and your name?
Yes, I'm Melissa.
Thank you.
My question is, are the trails, at least the initial trails, are they dog friendly?
I did the math. They are 41% dog friendly. So most of the regional parks are, yes, welcoming of dogs. Most of the other parks are not. And some of them are, you can bring your dog to the picnic area and the parking lot, but you can't have them on the trails, which is not helpful to us. So a little over a third of the trails are dog friendly. Most of the shorter, earlier ones.
Okay, perfect.
Yeah.
Thank you.
All right. Wait, there we go. Let's see. How many total hikers were there last year? There were 42. Penny? Um, good question. Audrey's asking, what if we train for 20 miles, but to decide to do 11 miles if we don't feel ready for 20? Great. And you don't have to decide that until just before the only reason we need that is so that when we create the schedule, we're starting the folks on May 21st who are hiking 20 miles. So we need that a week or two prior to May 21st. So you'll have plenty of time to figure that part out. If we're not able to participate the day of, can we still participate in fundraise? Yes, there's a couple of folks who are doing that, who've got a group of friends who want to participate, but they're unable to do the actual date because somebody's getting married that day, which is terribly inconvenient as far as I'm concerned. So yes, if you can't make it that day, yes, you can still participate in the training hikes. You'll even get the route. You can hike the route on a day that's not Epic Trail Challenge Day. And we may even be able to figure out a way to hike the route. If there's going to be more than one person or 2 or 3 people, we may be able to do another supported version of this in a smaller way. So yes, please go ahead and participate. If you join as part of a team, do you all have to do the same distance? No, you do not. We had several teams last year where some folks did the 11-mile route and others did the 20-mile route. We want you to do the length that works for you, and if that means you're doing different lengths, that's okay. Other thoughts or questions? It's exactly 7 p.m. I like the symmetry of starting and ending on time. So how about this? If you would like to leave now, because it's 7 o'clock and you've gotten your fill, please do so without any concern about missing anything awesome, because I'm going to send you the recording tomorrow. If you have more questions or want to say more, or have questions of folks who have already participated in the event, feel free to stay on, and I'll keep the recording rolling until there are no more people here. All right, so here are more questions. Here's your chance to go if you want to. How long does the 20-mile hike approximately take? That's a great question, Maria. So the average Epic Trail Challenger hikes about 2 miles an hour. So the many folks took about 10 hours. I can do math. Took about 10 hours to do the 20-mile route. That includes, of course, stopping and, checking your blisters to make sure they've popped or haven't popped, depending on your preference, taking a lunch break, seeing what's over there, if you're me. What's that? So yeah, it can take up to 10 hours. There are folks who have done it in much less, and they're magical. Other questions? Go ahead, Lila.
What happens if you have to stop in the middle of the hike?
We'll give you a ride back to your car and some food and love you and give you a t-shirt anyway.
Okay, I kind of figured that, but I think it's
Yeah. We've had 2 folks out of the 90 participants who have not opted to complete the challenge for one reason or another. And yeah, they both got loved up, and we made sure they got back to their car and back home okay. And yeah, they all was well. Any other questions? That was a great one.
I do have another question. Can we get the video of Naomi Fuchs?
Heck yes.
That is, I I'd love to show it tomorrow.
Oh,
Is it possible? I mean, because I'm going to a social action meeting and it really, this is kind of a group I want to make sure they know all about it.
yes. So I'm putting the link, the YouTube link,
Okay.
in our chat right now so that you can take it and use it. Have fun. Wait a minute. Let me make sure that's the wrong video.
Oh, yeah.
I thought I was so slick there for a second. All right, use this one. There you go. All right. Let's see. You're welcome. You're welcome. When will I know the hike on May 21st? Well, that is dependent on other people. So I don't know. I am currently working on the idea of trying to get back into the newest McCormick edition that's back behind Sugarloaf Ridge State Park, which is being made public at some point, but we don't know. I don't know if that land has been sold yet or purchased yet, if it's finished its purchasing process. Last week I reached out to Hood Mountain Regional Park and got a fairly unequivocal "no, you can't do that here" answer because of fire damage and uncertainty about what the which parts of that trail are going to be public. And there's part of it in Sugarloaf. So there's an email out to, I just put an email out to Sugarloaf today to say, hey, is this a possibility? I have to wait to hear back from them. That's my first, that's the option that I'm exploring right now, just so we have something different. It's possible that we'll go back to one of the ones that we did last year or the year before and do a repeat, which means that I have to get permits and deal with county and or state entities that may or may not be responsive. That was a really nice way of saying all that. Not sure. That's a long way of saying I'm not sure when I'll know. Before May 21st, though. We'll know for sure before the 21st. Go ahead.
Laurie, I know this is where I'm not really quite sure what's going on. You put that thing, you put the YouTube up there and I don't know where that information is now.
So if you move your mouse on your screen, a little list will open up at the bottom.
I have an iPad.
Okay. Well, how about this? I'm going to go ahead and stop our recording so we can do tech support for you.
Oh,
Hold that thought.